Well, we're glad to join you again today in another one of our updates. This is our fifth update since we started giving weekly information out, trying to equip you with what's going on here at Children's, with what are the things that you need to be thinking about through this pandemic. I want to touch on a few things today. I want to talk a little bit about monoclonal antibodies. We've talked about it a lot. We've been very successful with those infusion therapies. Dr. Childs, there's been some information in the news about the availability of the product that we use for the infusion. What do we know about that? How's it going to impact us over the next coming days?
Monoclonal antibodies have been very important at preventing hospitalization. We've been happy to be able to use it on a number of teenagers, 12 and ups. But there has been a disruption in the availability. We hope that's just very short-lived. But we have very few doses right now. We're having to prioritize who we give it to, hoping that the others will remain eligible, that we can by midweek, later in the week, give it to everybody that we think needs this therapy. But it is a problem right now.
And the disruption is not just a children's hospital disruption, it's disruption across the state and across the nation as to how doses are being allocated. So if you're a provider, or if you're a mother or father who have a high risk 12 or up who's eligible, what should you be doing?
So we're telling the providers who these families should be in touch with to still make the requests. We're keeping the list, and we want to get to everybody. We have had to do some prioritization, but we still want the requests, and we hope to be able to fill all those that need it as time goes.
So let's shift. There was some information over the weekend. Pfizer comes out and says what many parents have been waiting for, which is the 5 to 12-year-old vaccine, and say, good news, the vaccine is safe for 5 to 12-year-olds. What does that mean?
A lot of families are waiting for this news. This is just from Pfizer at this point. So this information now goes to both the FDA and the CDC to seek approval for down to age 5. That still has some time to pass. The latest I heard was good news in terms of it might be late October. For those who are anxious day to day, I know that still seems like a long time away. But remember a couple of things. First of all, COVID is a milder disease almost universally for that age range. But for those that are at risk, families are really looking to that availability of vaccine. So it looks like it's coming, but we want to hear not just from the manufacturer, but from the independent panels that look at the results that Pfizer has before it's approved.
So if I simplify that a little bit, it's great that there's enough data for the authorities to be able to review, right? And at least data suggests from the manufacturer's side that it's going to be promising. Still maybe have another 60 days or so at least to wait through that process.
I think that's accurate, something in that time frame.
So last thing is we've given a situational update each time. And where are we at here at Children's, and what are we seeing across the state as it relates to outpatient activity, hospitalizations, positivity rates?
So the worst of this affecting kids was in the western part of the state. Arkansas, Louisiana, Missouri were really early states in this surge. And so the western part of our state started with the surge, and it kind of migrated from west to east. If you look now at West Tennessee, it's looking way better. Over half of a decrease in their hospitalizations. Their case rates are down. Things are also down in the Nashville area, and we think things are crowning here in terms of plateau, starting down in terms of case rates, certainly in terms of hospitalizations. We had as many as 86 pediatric patients in the children's hospitals across the state. Now that number is in the 40s. We're really excited about that. Here at Children's, that's what we're experiencing. We still have some inpatients here. Over the last week, though, those patients are coming in less sick, and we have lower numbers. Our testing rates are in the mid-teens for positivity. They were in the mid-20s for positivity. We're still busy. The hospital's busy. The offices, urgent cares are busy, but there's room to breathe now, which is what we all have been looking for.
I think it's really positive news, and appreciate the opportunity to continue to bring this information to you. I want to draw the conversation with Dr. Childs to a close, and we want to give a perspective that you perhaps haven't heard yet, a perspective from one of our experienced frontline intensive care nurses who can explain what it's been like from her experience. So for the last few weeks, we've had the opportunity to bring news, and Dr. Childs and I have tried to do that in a way to equip families, to equip you with the latest information. This morning, one of our frontline ICU nurses is here with us. Nickie is here, and I appreciate your time, Nickie, this morning. Give the folks who are watching this a little bit of perspective, your background. How long have you been a nurse and an ICU nurse here at Children's Hospital?
So I was actually a new graduate nurse here at Children's in the PICU. I started in 2015, so 6 years.
6 years. And throughout 6 years, you take care of a lot of different patients, right? And particularly being in the pediatric ICU, a lot of patients who are really ill. And right now we're talking a lot about COVID. What has it been to take care of the patients who have gone to the ICU who are suffering from COVID?
They can be very, very sick, anywhere from needing just like some high flow nasal cannula support for a few days to having multi-system organ failure and needing a lot of support with their blood pressure and their breathing and having to have a breathing tube to help them breathe. So these kiddos can be very, very sick.
Is there any consistency, Nickie, between ages, comorbidities, underlying conditions for those sickest patients?
Sure. The sickest kids that I have seen have been teenagers, and a lot of them have been obese.
Okay, a lot of them obese. Any of them vaccinated that you're aware of?
Not that I'm aware of.
So you mentioned about what you're trying to do to take care of them from a therapy perspective. There's also what you're doing to take care of yourself and your coworkers. We talk about PPE. What does that mean? How does it make the job more challenging for you and your team?
Sure. So it's a lot. We have to wear a lot of things to protect ourselves, our families, our other patients. So we have to wear gowns and a special N95 mask that I'm sure you've heard talked about, and eye protection. So all that can be a little bit exhausting itself, and then it adds kind of an extra layer of difficulty when caring for these patients because it's more difficult to make a personal connection with your patient and their family when most of your face is covered.
Even more challenging, you mentioned the family there. Oftentimes, unfortunately, some of the patients that we're caring for that are positive, family members are also positive. So their support system, your support system as a care provider with the family is more challenged. Is that accurate?
That is accurate. Sometimes the parents are sick and can't be here with their children, which is sad and difficult for the kid and the parent. And we have to try to limit, if the parents are there, we have to try to limit their movement through the hospital so that we're not spreading COVID.
Yeah, it's a challenging scenario. You mentioned before we started the discussion today, you can't hug your patient, you can't hug your family, and that's different, right? In a pediatric environment, we're used to that type of interaction, and when we can't have it, it's even more heavy from a care perspective. So give the folks who are watching an idea, how are you and your teams doing? It's been a long 18 months.
It has been a long 18 months. It can be emotionally trying, like you said, because you don't necessarily make those connections. So just kind of leaning on your coworkers and, just talking about it amongst yourselves and just doing your best to make those connections when you can with your patient.
And you're not just a nurse, not just a pediatric intensive care nurse, also a mother, right? That's a different burden. So you see this through both a caregiver's lens and a mother's lens. What does that mean to you?
It's hard for me to see these moms and dads that are seeing their children so very sick, and we're doing everything that we can for them. It worries you too that I try to protect myself as much as I can so that I don't bring it home to my own child, because nobody wants to see their child have to wind up in the ICU.
Yeah, it's not an outcome that anybody wants. It's not even an outcome that the team who's here it's prepared to take care of those children want. So if you had one message to share with those watching today, what would it be?
Just do your best to protect yourself and your family. Get your children care as quickly as possible if you're concerned about them. And just try to show a little bit of grace to people in the healthcare world, because it is a little bit trying right now.
So I appreciate that. So as we sum up today, I want to thank Nickie for sharing her story today. Her story is not unique. There are a number of folks who every day here at Children's across this region care for critically ill patients and do so because it's their passion. It's because they were meant to do, but it doesn't make it easy, as you heard Nickie say today. So as we close, a couple of things. We are going to continue to make sure that we are available to give monoclonal antibodies as we have supply. Continue to work with your provider if you happen to fall in that range. As you heard Nickie say, protect yourself. The best way to do that, if you're eligible for the vaccine and you hadn't taken it, consider it again. Take the vaccination. Basic rules of hygiene. Don't go places if you're sick. Wash your hands, all of those things. And maybe the one message I'd give you today is what you heard Nickie close with, is give each other grace. No matter whether you're here seeking care because you or a family member are ill, or out in the community, instead of spreading illness, spread some kindness. So thank you for joining us today. Thank you for trusting us with your care. And thank you for Nickie for being with us as well. Have a great day.